When a patient is confronted by illness, it does not immediately matter where the doctor was trained, which company created the latest drugs, or who has written the most articles on the treatment of their condition. The patient wants the right and most successful treatment as fast as possible, with minimum impact on their life. Jane has been diagnosed with lung cancer. She and her family will face many concerns in the coming months, but it is the early diagnosis and treatment of her disease that could make all the difference. Elsevier's health information solutions and the rich quality of clinical knowledge that underpin them help physicians and healthcare providers make better decisions, deliver better care, and sometimes make groundbreaking discoveries, improving outcomes for patients. So let's consider Jane's story. Key to Jane's early diagnosis was access to health information in the identification and treatment of her illness through an easy-to-use symptom checker, making her aware of what to look out for when things did not improve. The triage nurse who supported Jane through a telephone consultation transferred her understanding of the clinical presentation into practice. The ability to listen for non-visual clues in a patient's response would have been established at university, combining theory, practice, and communication skills developed through Elsevier's education solutions. As Jane's symptoms worsened, assessment by a clinician was required. Although her primary care GP had spent many years in practice, she will remain reliant upon medical journals and research papers to update her knowledge and stay informed of the latest best practice. The care pathways provided to the GP practice by Elsevier Clinical Solutions or other sources are underpinned by evidence-based content from Elsevier and integrated with the patient record to ensure that Jane's treatment was fully personalised to her needs. As Jane's journey progressed into specialist care, treatment interventions were conducted by the right team of skilled and caring people. Medical students working with experienced consultants are able to recommend the most effective tests and diagnostic procedures based on research undertaken for their exams. Practicing clinicians using the same knowledge base developed comprehensive diagnosis and treatment plans, shared with Jane's wider care team through easy-to-use tools such as order sets and care planning. It was only by fostering a culture of learning that the consultant in charge of Jane's care could rely upon a well-trained and knowledgeable care team. Members of her team frequently used multiple sources of clinical information to guide best practice, ensuring the right care was provided to Jane to improve her health and well-being. The clinicians who helped Jane were regularly presented with information on the latest drug trials and the impact on outcomes, meaning they could make informed decisions and guide treatment plans. Jane is now receiving continuing care. Although she may still be unaware of Elsevier, it is our quality information solutions that have supported her medical team in the delivery of ongoing expert care. This, plus the help of Elsevier patient engagement solutions, means she now feels informed and more confident in the next stage of her treatment. For Jane and many others, it is the early diagnosis and delivery of quality care that has improved the likelihood of positive outcomes. With a care team supported by Elsevier Information Solutions, she has benefited from the extra time available to talk and understand the best options for both herself and her family.